What is eating disorder? An eating disorder is a mental disorder defined by abnormal eating habits that negatively affect a person's physical and/or mental health. They include binge eating disorder, where people eat a large amount in a short period of time. Anorexia nervosa, where people eat very little due to a fear of gaining weight, and thus have a low body weight. Bulimia nervosa, where people eat a lot, and then try to rid themselves of the food. Pica, where people eat non-food items. Rumination syndrome, where people regurgitate food. Avoidant, or restrictive food intake disorder (ARFID), where people have a reduced and selective food intake due to some psychological reasons, and a group of other specified feeding or eating disorders. Anxiety disorders, depression and substance abuse are common among people with eating disorders. These disorders do not include obesity. The causes of eating disorders are not clear, although both biological and environmental factors appear to play a role. Eating disorders affect about 12% of dancers. Cultural idealization of thinness is believed to contribute to some eating disorders. Individuals who have experienced sexual abuse are also more likely to develop eating disorders. Some disorders such as pica and rumination disorder occur more often in people with intellectual disabilities. Only one eating disorder can be diagnosed at a given time. Treatment can be effective for many eating disorders. Treatment varies by disorder and may involve counseling, dietary advice, reducing excessive exercise, and the reduction of efforts to eliminate food. Medications may be used to help with some of the associated symptoms. Hospitalization may be needed in more serious cases. About 70% of people with anorexia and 50% of people with bulimia recover within 5 years. Recovery from binge eating disorder is less clear, and estimated at 20% to 60%. Both anorexia and bulimia increase the risk of death. In the developed world, anorexia affects about 0.4%, and bulimia affects about 1.3% of young women in a given year. Binge eating disorder affects about 1.6% of women, and 0.8% of men in a given year. Among women, about 4% have anorexia, 2% have bulimia, and 2% have binge eating disorder at some time in their life. Rates of eating disorders appear to be lower in less developed countries. Anorexia and bulimia occur nearly 10 times more often in females than males. Eating disorders typically begin in late childhood or early adulthood. Rates of other eating disorders are not clear. Bulimia nervosa is a disorder characterized by episodes of binge eating and purging, as well as excessive evaluation of one's self-worth, in terms of body weight or shape. Purging can include self-induced vomiting, over-exercising, and the use of diuretics, enemas, or laxatives. Anorexia nervosa is characterized by extreme food restriction, low body weight, and the fear of becoming fat. Pubertal and post-pubertal females with anorexia often experience amenorrhea, or the loss of menstrual periods, due to the extreme weight loss these individuals face. Although amenorrhea was a required criterion for a diagnosis of anorexia in the DSM-IV, it was dropped in the DSM-5 due to its exclusive nature, as male, post-menopause women, or individuals who do not menstruate for other reasons, would fail to meet this criterion. Females with bulimia may also experience amenorrhea, although the cause is not clear. Two subtypes of anorexia nervosa are specified in the DSM-5, restricting type, and binge eating, purging type. Those who have the restricting type of anorexia nervosa restrict food intake and do not engage in binge eating, whereas those with the binge-purge type lose control over their eating, at least occasionally, and may compensate for these binge episodes. Although similar in presentation to bulimia, individuals with the binge-eating, purging subtype of anorexia are typically underweight, whereas those with bulimia tend to be normal weight, or overweight. Eating disorder symptoms and long-term effects. Symptoms and complications vary according to the nature and severity of the eating disorder. Associated physical symptoms of eating disorders include weakness, fatigue, sensitivity to cold, reduced beard growth in men, reduction in waking erections, reduced libido, weight loss and growth failure. Frequent vomiting, which may cause acid reflux or entry of acidic gastric material into the laryngoesophageal tract, can lead to unexplained hoarseness. As such, individuals who induce vomiting as part of their eating disorder, such as those with anorexia nervosa, binge eating purging type, or those with purging type bulimia nervosa, are at risk for acid reflux. Polycystic ovary syndrome (PCOS) is the most common endocrine disorder to affect women. Though often associated with obesity, it can occur in normal weight individuals. PCOS has been associated with binge eating and bulimic behavior. Other possible manifestations are dry lips, burning tongue, parotid gland swelling, and temporomandibular disorders. Pro-ANA subculture. Pro-ANA refers to the promotion of behaviors related to the eating disorder anorexia nervosa. Several websites promote eating disorders, and can provide a means for individuals to communicate, in order to maintain eating disorders. Members of these websites typically feel that their eating disorder is the only aspect of a chaotic life that they can control. These websites are often interactive and have discussion boards where individuals can share strategies, ideas, and experiences, such as diet and exercise plans that achieve extremely low weights. A study comparing the personal weblogs that were pro-eating disorder, with those focused on recovery, found that the pro-eating disorder blogs contained language reflecting lower cognitive processing, used a more closed-minded writing style, contained less emotional expression, and fewer social references, and focused more on eating-related content than did the recovery blogs. Eating disorder psychopathology. The psychopathology of eating disorders centers around body image disturbance, such as concerns with weight and shape, self-worth being too dependent on weight and shape, fear of gaining weight, even when underweight, denial of how severe the symptoms are, and a distortion in the way the body is experienced. The main psychopathological features of anorexia were outlined in 1982 as problems in body perception, emotion processing, and interpersonal relationships. Women with eating disorders have greater body dissatisfaction. This impairment of body perception involves vision, proprioception, and tactile perception. There is an alteration in integration of signals in which body parts are experienced as dissociated from the body as a whole. Brooke theorized that difficult early relationships were related to the cause of anorexia, and how primary caregivers can contribute to the onset of the illness. A prominent feature of bulimia is dissatisfaction with body shape. However, dissatisfaction with body shape is not of diagnostic significance, as it is sometimes present in individuals with no eating disorder. This highly labile feature can fluctuate depending on changes in shape and weight, the degree of control over eating and mood. In contrast, a necessary diagnostic feature for anorexia nervosa and bulimia nervosa is having overvalued ideas about shape and weight are relatively stable and closely related to the patient's low self-esteem. Eating disorder causes. The causes of eating disorders are not clear. Many people with eating disorders also have body dysmorphic disorder, altering the way a person sees oneself. Studies have found that a high proportion of individuals diagnosed with body dysmorphic disorder also had some type of eating disorder, with 15% of individuals having either anorexia nervosa or bulimia nervosa. This link between body dysmorphic disorder and anorexia stems from the fact that both BDD and anorexia nervosa are characterized by a preoccupation with physical appearance and a distortion of body image. There are also many other possibilities, such as environmental, social, and interpersonal issues that could promote and sustain these illnesses. Also, the media are oftentimes blamed for the rise in the incidence of eating disorders due to the fact that media images of idealized slim physical shape of people, such as models and celebrities, motivate or even force people to attempt to achieve slimness themselves. The media are accused of distorting reality, in the sense that people portrayed in the media are either naturally thin, and thus unrepresentative of normality, or unnaturally thin, by forcing their bodies to look like the ideal image by putting excessive pressure on themselves to look a certain way. While past findings have described eating disorders as primarily psychological, environmental, and sociocultural, further studies have uncovered evidence that there is a genetic component. Eating disorder genetics. Numerous studies show a genetic predisposition toward eating disorders. Twin studies have found a slight instances of genetic variance when considering the different criterion of both anorexia nervosa and bulimia nervosa, as endophenotypes contributing to the disorders as a whole. A genetic link has been found on chromosome 1 in multiple family members of an individual with anorexia nervosa. An individual who is a first-degree relative of someone who has had or currently has an eating disorder is 7 to 12 times more likely to have an eating disorder themselves. Twin studies also show that at least a portion of the vulnerability to develop eating disorders can be inherited, and there is evidence to show that there is a genetic locus that shows susceptibility for developing anorexia nervosa. About 50% of eating disorder cases are attributable to genetics. Other cases are due to external reasons or developmental problems. There are also other neurobiological factors at play tied to emotional reactivity and impulsivity that could lead to binging and purging behaviors. Epigenetics mechanisms are means by which environmental effects alter gene expression via methods such as DNA methylation. These are independent of and do not alter the underlying DNA sequence. They are heritable, but also may occur throughout the lifespan, and are potentially reversible. Dysregulation of dopaminergic neurotransmission due to epigenetic mechanisms has been implicated in various eating disorders. Other candidate genes for epigenetic studies in eating disorders include leptin, pro-opiomelanocortin, POMC, and brain-derived neurotrophic factor (BDNF). Psychological of eating disorder. Eating disorders are classified as Axis I disorders in the Diagnostic and Statistical Manual of Mental Health Disorders (DSM-IV), published by the American Psychiatric Association. There are various other psychological issues that may factor into eating disorders. Some fulfill the criteria for a separate Axis I diagnosis, or a personality disorder, which is coded Axis II, and thus are considered comorbid to the diagnosed eating disorder. Axis II disorders are subtyped into 3 clusters: A, B and C. The causality between personality disorders and eating disorders has yet to be fully established. Some people have a previous disorder which may increase their vulnerability to developing an eating disorder. Some develop them afterwards. The severity and type of eating disorder symptoms have been shown to affect comorbidity. The DSM-IV should not be used by laypersons to diagnose themselves. Even when used by professionals, there has been considerable controversy over the diagnostic criteria used for various diagnoses, including eating disorders. Eating disorder personality traits. There are various childhood personality traits associated with the development of eating disorders. During adolescence, these traits may become intensified due to a variety of physiological and cultural influences, such as the hormonal changes associated with puberty, stress related to the approaching demands of maturity, and socio-cultural influences, and perceived expectations. Especially in areas that concern body image. Eating disorders have been associated with a fragile sense of self and with disordered mentalization. Many personality traits have a genetic component and are highly heritable. Maladaptive levels of certain traits may be acquired as a result of anoxic or traumatic brain injury, neurodegenerative diseases, such as Parkinson's disease, neurotoxicity, such as lead exposure, bacterial infection, such as Lyme disease, or parasitic infection, such as Toxoplasma gondii, as well as hormonal influences. While studies are still continuing via the use of various imaging techniques such as fMRI. These traits have been shown to originate in various regions of the brain, such as the amygdala and the prefrontal cortex. Disorders in the prefrontal cortex and the executive functioning system have been shown to affect eating behavior. Eating disorder diagnosis. The initial diagnosis should be made by a competent medical professional. There are many medical disorders that mimic eating disorders and comorbid psychiatric disorders. Early detection and intervention can assure a better recovery, and can improve a lot the quality of life of these patients. All organic causes should be ruled out prior to a diagnosis of an eating disorder, or any other psychiatric disorder. In the past 30 years, eating disorders have become increasingly conspicuous, and it is uncertain whether the changes in presentation reflect a true increase. Anorexia nervosa and bulimia nervosa are the most clearly defined subgroups of a wider range of eating disorders. Many patients present with subthreshold expressions of the two main diagnoses, others with different patterns and symptoms. It is essential to develop specific scales for people under 18 years of age, given the increasing incidence of ED among children, and the need for early detection and appropriate intervention. Early detection of ED in children implies a simple and accurate evaluation at the primary care level or in schools, as the course of the disease can be subclinical for several years. Thanks for watching our video. Make sure you subscribe to receive more video related to eating disorder treatment, and many other everyday health and wellness. Don't forget to leave a comment, hit the like button, and share our video. Thank you so much for watching. Be safe, and stay healthy.